Hornsby is a PhD candidate within the Department of Civil and Environmental Engineering at Stanford University. Her talk is entitled Quantifying the Effects of Water, Sanitation, and Hygiene for WASH, Education, and Infrastructure Operation and Maintenance on students' toilet use and hand washing in Indian primary schools. So thank you, Gracie, and take it away.
My name is Gracie Hornsby. I am a PhD candidate in Civil and Environmental Engineering, also working with Gary Darmstadt and then Jenna Davis in that department as well. So today I'll present the top-line results from a randomized controlled trial in India that tests the hypothesis that both WASH education and an enabling infrastructure environment are both necessary to spark lasting behavior change among those students. But why are we even talking about schools? It's because schools are often utilized as a more cost-efficient way to deliver WASH programming or to increase access to WASH facilities than intervening at the individual household level. While schools do present a unique opportunity in this way, poor operation and maintenance of those facilities can then prevent students from using the facilities, forming healthy habits, and actually reaping the long-term benefits that we want them to from those infrastructure investments. So if we look at previous WASH in school studies, the literature really lacks consensus on effective approaches for behavior change that, sparking behavior change in the short term and actually sustaining it in the long term as well. So against that backdrop of literature, this study contributes rigorous evidence on both the individual and the combined impacts of WASH education and then this operation and maintenance or O&M support on student toilet use and then hand washing in the Indian context. So let's talk about the education intervention first. This is a 12-session play-based WASH curriculum that was developed by leading experts in child behavior change programming and then delivered by trained teachers that already work in these schools. The O&M part of this trial provides part-time cleaners that are contracted by a private third-party agency to clean 2 hours daily in each of these schools. So the cleaners' responsibilities include cleaning hand washing stations and toilets, checking for relevant consumables like water and soap, the things we need to wash our hands, but then also reporting if there is non-functionality or missing consumables to an authority figure in the school. And so it's important to note that cleaning supplies were provided by this third-party agency, but schools were individually responsible for provisioning soap for student hand washing. That's foreshadowing for later. These interventions were allocated according to a 4-arm cluster randomized design. So schools could receive only the curriculum, only O&M support, both, or in the case of our control, neither. Significant investment was actually made prior to the start of this trial to normalize WASH infrastructure conditions across these schools. This was a real deficit cited in prior trials. And so we would have comparable baseline infrastructure availability, and that wouldn't affect our analyses later, thinking about availability and student choice around using these facilities. The trial took place in 200 government schools in Uttar Pradesh, India, so northern India, as highlighted on the map. And within these 200 schools, we randomly selected a gender-segregated sample of 20 first graders and 20 fourth graders, yielding a total sample of 8,000 students in this trial. Data was collected over the course of 13 months with structured surveys at baseline, midline, and endline, like we're familiar seeing in many randomized controlled trials. We also undertook observational data collection on infrastructure conditions as well as student behavior at 9 and 8 time points respectively. And observational data collection was an important and differentiating aspect of this trial, since self-reported outcomes are really common in WASH in schools literature, despite being commonly criticized in the literature as well. We registered a pre-analysis plan with 3 IDs, Registry for International Development Evaluations, and importantly, our treatment arms remained blinded until we completed all of the analyses in that pre-specified plan, and those are the results that you'll be seeing today. So now let's get into the results and look at a student knowledge outcome. Based on output from a generalized mixed effects regression, you can ask me more about that later, we have predicted probability on the y-axis and time on the x-axis and we'll look at the probability of a student reporting accurate and relevant knowledge of germs when asked in our structured surveys. So you can see that student knowledge of germs improved significantly more in our two curriculum arms, shown in green and purple, shooting out to the sky. And this is compared to the O&M only in the control arms, which represent that status quo education that students are receiving at Uttar Pradesh. So student knowledge of germs increased 3.5-fold more in the curriculum arm and 4.5-fold more in the curriculum plus O&M arm as compared to the trend in the control. So simply from this, we conclude that student knowledge of WASH improved, and that is attributable to the curriculum intervention. So now we'll look at one of many infrastructure outcomes that we measured in this trial. And you can feel there's a story building here, just stick with me. So this is a bit of a representative sample of our results. So again, based on output from the mixed effects GEE model, we have predicted probability on the Y. No, go back. Just kidding. We have predicted probability on the Y and time on the X, and we're looking at the probability of a student toilet being unlocked when our observers came for an unannounced spot check, so the schools did not know that we were coming these days. So again, we see this kind of similar separation between arms post baseline, but now it's our O&M only arm in blue and our curriculum plus O&M in purple that outperformed the curriculum and control arms, kind of as we may have expected. So toilet availability increased 15 percentage points in the O&M arm and 21 percentage points in the curriculum plus O&M arm as compared to our control. But let's talk a little bit more about infrastructure broadly, not just this particular outcome, because our other indicators follow a similar trend. We could say that toilets were more likely to be unlocked, able to flush properly, have water for anal cleansing, and to be clean enough for a student to go use. And so thus, again, we conclude that the O&M intervention meaningfully improved the enabling environment concerning toilet use in schools. However, I also mentioned hand washing earlier. When we talk about hand washing, I need to mention that schools rarely made soap available to their students. This was in less than 20% of observations, we actually found soap available to students, whereas water for hand washing was nearly universal. 90 to 98% of our observations had some sort of water available for hand washing. So from this, we have to say that the enabling environment for hand washing at these schools did not meaningfully change between our O&M intervention arms versus curriculum only and control. And I mention this because it impacts our ability to comment on how O&M impacts student hand washing behavior in these contexts. And once again, that's foreshadowing for just a couple slides from now. So now let's look at behavior. I know I kind of rushed through those slides, but behavior is ultimately where we wanted to land in this presentation. So we defined the rate of toilet use as the number of students using the toilet during a randomly chosen 2-hour observation window during the day. And that's divided by the entire estimated daily attendance at a given school. Thus we expected the absolute rates that we were calculating to be relatively low if you compare that numerator and denominator. But we're mostly interested in looking at differences between our treatment arms and then change over time. And so as you've probably already noticed, this graph looks a little bit different and less clean than the ones that we've looked at previously. So the rate of student toilet use was low. During these 2-hour observation periods fluctuated between, on average, just 2 and 15% of students using the school toilet. But we did detect evidence of a small but statistically significant increase, about 2 percentage points, in the predicted probability of a student using the school toilet in the O&M arm, noted in blue on the slides. And this is also corroborated by our peer-reported data on toilet use that we just don't have time to dive into today. So while these effect sizes are smaller than our knowledge and enabling environment outcomes or the infrastructure outcomes, the important takeaway here is that when we did observe an effect on student toilet use, it was driven by this operation and maintenance arm. But now we need to talk about hand washing. The rate of student hand washing during the 2-hour period was also low, fluctuated between just 8 and 15% of students. And the most important thing to take from this graph is that no treatment condition meaningfully changed or statistically changed the trend in the control arm. But as I noted a few slides ago, the O&M arms were not meaningfully different from our curriculum and control arms. So here, what we're really looking at is the potential effect of the WASH curriculum on student hand washing. And so the big question is, what does this mean for Washington schools? There's a lot of funding coming from a limited pot that goes into funding programs like this in Washington schools. So I would argue big picture, one fundamental function of a school is long-term knowledge acquisition and then application for its students. Wash knowledge formation is important for students on a longer time horizon, navigating a contaminated built environment throughout their entire life. And so the curriculum was very effective in developing wash knowledge. However, the important takeaway is that this analysis does not support the claim that improvements in wash-related knowledge is a key component of near-term behavior change, particularly in the school environment. Additionally, we didn't find evidence of any synergistic impact of delivering education and O&M together in terms of student behavior change outcomes. The thing that we did detect was a modest effect of O&M on toilet use, but we have to recognize that the magnitude of near-term behavior change under any treatment condition in this trial was quite low, considering the significant financial investment for infrastructure upgrades and curriculum development, materials, teacher training, and then holding a contract with a third-party agency. This was not a low-cost trial. These are not necessarily low-cost interventions. And so that's really what our follow-up analyses will aim to explaining these small effect sizes. We're looking to understand the characteristics of higher and lower performing schools in terms of student behavior. We're also looking to explain a little bit more of the heterogeneity that we see in our data. We also want to understand the conditions under which schools did and did not keep toilets unlocked and provision soap and keep water for anal cleansing, particularly when they were receiving quite a lot of O&M support. There were clearly some unaddressed barriers there. And lastly, I'll note that we actually could have reported far more optimistic outcomes today if we had chosen to only report self-reported data, which we did also collect, but we chose to rely on our observational data because we felt it was far more accurate. In the future, we'll be looking to better situate our findings in the rest of Washington schools literature, because there is quite a strong trend of studies that measure via self-report concluding positive effects, whereas studies that measure via observational data conclude either very small or no effects, and we feel that we have the data to comment on that trend since we measured our indicators across multiple measurement techniques. So we will perform this more in-depth comparison, and I'm always happy to talk about methods with other researchers as well. But thank you to all of my collaborators, and thank you for listening.
Thank you, Gracie, for a really interesting presentation. So now I invite people from the audience who have questions for Gracie to come up here to the microphone. And while I guess we're waiting for someone, it looks like we've got one person, but I've got a question for you, which is just around evidence dissemination. And I'm assuming that you probably have like a manuscript that you're working on for publication. But I'm curious too, and this is something that Dr. Mazet talked about in her keynote address, just about the importance of like closing the loop for communities who are participating in the research. So I guess I was just wondering, like, could you speak to how you shared these results with the participating schools?
Yeah, I'm happy to, because that is still a work in progress. So we have really, really wonderful in-country collaborators who have fostered really meaningful relationships with government over the years. So there has already been one workshop to talk with the local government officials, kind of at like the block and district level, so some levels below the state government level, who were instrumental in this trial taking place because they gave us important permissions to be allowed to work in their schools. And like you said, we wanted to close that loop and make sure that they knew some of the preliminary findings from this study. We do have another workshop planned coming up in, I'll say, the next 6 months. Timelines are fuzzy as a PhD student, because we do also want to circle back to, we had 100 cleaners who were hired to work in these schools that deserve to know the impact of their work in schools and local government. And ultimately, the goal of this work is to be able to give guiding advice to local government on what's happening in their schools and what the kinds of impacts that these interventions can have.
Thank you.
Thank you so much. It's a really, I'm an anthropologist, it's a really interesting set of questions to be thinking about. Do you or your team have any either qualitative evidence gathered during this particular piece of research or any avenues that you're looking to explore around what, like the word comes out, barriers might be getting in between students and use of facilities. I think even about structural things, about the way that days are structured, whether teachers have the opportunity, like, do students have the time to use the bathroom? It's not just things like cultural or gender-based barriers that sometimes show up in wash and toilet use.
Yeah, we should talk afterwards. I love talking anthropologists. So we did undertake qualitative work alongside this evaluation pretty much at every stage. So we did rounds of qualitative interviewing during our formative work when we were newly designing this operation and maintenance intervention. So that's where the term barriers came up most for us. We were looking to diagnose and simply address barriers. It comes up now on the back end again because it seems there were some unaddressed barriers that we did not capture in that first round of formative work, which is not entirely surprising. Interventions are iterative. It is not something that is designed perfectly the first time necessarily. And in our qualitative interviews, we did some targeted interviewing around soap availability because it just continues to be a more difficult problem than we expect it to be, and also difficult to interview on. Even among the people who we prompted and said, oh, well, schools near here seem to have problems provisioning soap when we know from our data that this is a school that has difficulty provisioning soap. Those were really difficult conversations to get people to engage with us on. And I'm curious how many questions we'll be able to answer versus how many questions we will need to throw back to the WASH community and say we still weren't able to comment on this.
Hi, Gracie.
Hi, Dr. Levy.
Thanks for your presentation. Really interesting work, and I particularly appreciate the clarity of your presentation. If you were given a chance in the funding to go back and try again, iterate again, what would you change with the innovation?
Great question. Also, Dr. Schwab asks me this question at UNC every year I present, and I should be better at answering it by now. I think one thing that really hindered the way we hoped that this operation and maintenance intervention would function was that we overlooked the importance of market competition when contracting a private agency. We had written in financial penalties for non-performance to the agency's contract that we held with them. Because we thought a lot about accountability in this trial, how you keep people accountable for delivering the services that they are supposed to be delivering, particularly in a governmental system that is known for financial corruption and kickbacks, and that these are well-established systems. So while we wrote those penalties into the contract, our in-country collaborators who actually held the contract and were responsible for levying the financial penalties were very, very hesitant to actually levy them. And it took us a long time as a research group, as collaborators, to understand why. And they said, it's going to ruin the trial if this agency goes away. If he pulls out, there's not another option for another agency to deliver these services, and there's been so much invested in this trial. And so if I could go back, we would not implement until we had at least 3, maybe 4 bids. And if we were implementing in an area where there was actually market competition, we could actually levy the financial penalties that we had planned, and that we could be serious about taking the contract elsewhere if they were not delivering on the services that they promised.
Thank you for a really nice talk and a really great project. And as a child and adolescent health services researcher, I can't help but think about sort of the environmental context of families and the teachers in the setting. And it reminds me of work around oral hygiene training for immigrant populations, and it really required changing the parents' attitudes and behavior in order to create sustainable change. And so I'm wondering what you think about the broader context of what the parents of these school kids were thinking about with WASH interventions and how that might play into a future activity.
Yeah, it is a great question. I also want that literature source because I think it could be relevant here as well. Some work prior to this study that took place with the same educational intervention, but in Zambia, address this idea of children as an agent of change. Can the messages that they're learning at home be transmitted to the parent? And I think broadly the answer that was found was not really. That's a big power dynamic to work across. Let's focus on the impact of the student and if they will carry that with them throughout their lifetime. So that's where we started thinking about parents, was this agent of change piece. That was not a part of this research agenda in the second evaluation, but we did do focus group discussions with parents to understand their attitudes about water and sanitation. Some of that data still needs to be analyzed, but I think you're touching on a really important thing, which is a next step of this work. When we're making recommendations about wash in schools, if we can't find these moderators that tell us, oh, these are the conditions under which this was more successful, these are the kind of schools where we will see impact in, if a real possibility that we need to contend with is if wash in schools and the exposure time from these programs being about 6 hours a day, will that ever be enough to overcome the influences that a child is experiencing at home? And while it is more cost efficient to intervene in schools, if it's not getting us the impact we want because the investment is not low, do we need to look back at the household environment? And particularly the parental influence there.
Thank you, Gracie, for that.